Coming to Lakewood offers me that opportunity to have more connection with my patients because it is a rural setting and because my patients are my neighbors and important members of the community.
Every day I like to think I can answer the question, if this was my family, I did the best for them.
And nobody wants to have surgery, but if you're going to have surgery, it's nice to know that the people that are taking care of you are going to do the best they can to get you through it.
I think the most important part as a physician in general is just being a good listener. I think that's how you really get to know who your patient is. Just got to sit back and let them tell their story and listen.
I'm lucky to have a chance to work in a place that's so much like a family. The whole building works very closely together, and I think the care is coordinated between all the physicians in a very seamless manner. That includes me getting a chance to work with my daughter and her husband, both family medicine physicians.
And I have family that live down in Rochester. And so they were kind of concerned about me being in a very small hospital when I brought them up here to visit. And they met the doctors, they met the nurses, they sat with me for a day. They were like, oh my goodness, that is like a family up there. That's something you cannot get in a large hospital.
The collaboration between all the groups really helps us get the better patient outcomes. I think that patients can see that. I think they'll see that Lakewood is a very positive place, and I think they'll see the morale is wonderful. I think there's not a person in this building that doesn't like her job.
Everybody here is really dedicated to taking care of that person, not just a patient, but they're taking care of a person. And I think that they're all committed to that. I mean, there's no, that's my job, that's your job. It's what can we all do as a team to take care of the patient. We
do have case managers following them through and kind of guiding them so they don't have to feel like they're lost in the system. We're going to go here next, this is what's going to happen there. Kind of letting them know ahead of time so they're not worried so much about what's going to happen next. And the patients really enjoy that because they feel like they're being taken on a walk that's a little more easy to undergo.
I came from an academic center before I was here, and it was very high tech. They had all the fancy gizmos that all the other university centers have, and here at Lakewood we have the same stuff. And I think people don't realize that sometimes is that they think that they should go to a big university center so that they can have the latest technology or tests, and we have all that stuff here, which is really a great thing. I mean, this is a very modern, high-tech facility, and I'm very impressed with what we have here.
The operating room is the place I like to be the most as a surgeon, and most surgeons would say the same thing. We feel the most comfortable here. We have all the tools we need to make people better. We have a plan and a backup plan to take care of the patients. We have x-ray equipment, laparoscopic, endoscopic instruments and tools to fix any problems we discover, and we have a good outcome because we have such a good team taking care of them.
When Dr. Lenz and Dr. Henson schedule cases, often they'll come and talk to us ahead of time to make sure we're better prepared in the anesthesia department to care for their patients, which is really unique. Coming from a bigger center, that was one of the big draws for me here, was that personalized, patient-centered care. We can collaborate together and plan out what would best fit each patient's need instead of being so pushed for time as you are in the big centers to rush patients through.
The team in the operating room, the anesthetists, the nurses, the scrub techs, the assistants in the operating room all work as a team to make things as safe as possible. And we're all comfortable in the operating room. We spend most of the days in the operating room, and that's our place to do our work, and we do our best work there.
The traditional role or model in medicine is a paternal model. The patient comes to you, you say, I'm the physician, this is what's wrong, this is what you're getting. But I think today it's not that way. It's saying, here's what your problem is, here are what your options are. Let's choose what's best for you based on who you are, and I think that's really important.
I think the patients understand that we're taking care of the whole body, not just the hernia or not just the gallbladder. We want to evolve into taking care of Susie, not just her liver.
One of the unique things we bring at Lakewood here is that we're able to take the time with every single patient to really get to know them.
The team of the nurses that surround you here are incredible. I got a lot of numbers to call. They answered all my questions. I think I have like 8 numbers in my book. I did call them for different reasons, different questions, and they always return my calls. They may not do it right away because I understand they're busy, but they do it that same day, even if I've had them at 6:30 at night. So, yes, I very much appreciate that.
This is a great place to come. as a patient because you're really getting a lot of one-on-one care, and I think people are going to spend more time to make sure you get what you need.
They were just, it's incredible. It was just an incredible place to be. Never in a hospital have I had that much compassion.
And then as they go through that whole experience, whether it's surgery or just some sort of other treatment, I think that being with them along the way and being available is really important. You know, they'll get home after they just got a diagnosis of something that's seemingly terrible, and then all their questions come rushing to them. They're like, oh, I should have asked this and I should have asked that. And you know, being available by phone call or just they can call me and say, hey, can I just come see you and ask a few questions? I think that's really important.
Lakewood is a great place to help you live well. I think if you come here and experience what happens at Lakewood, I think you'll notice that's true.
I just can't say enough about the surgeons here, or the doctors, or the nurses. The compassion that they have and the patience that they have. Incredible.